Hey guys, it's the doc. And before we even start, I just want to thank all of you for getting us up to over 200,000 subscribers. We have a wonderful community, which we've built together. And I thank each and every one of you from the bottom of my heart. And I look forward to this community continuing to expand and grow. And we nourish and enjoy each other. So thank you. So in this week's video, we're going to do a reaction video. As many of you may recall, and there's some, for the newer folks that are here, there was a period where my videos were basically banned from YouTube, and I was required to make a members only area. And this was during the pandemic. So a lot of those videos didn't get tons of views, even though there were some bangers in there. So we're going to share one of those with you, and I'm going to give you a little commentary. Just, there's lots of questions that we get asked in the comment section, and this is a great opportunity for me to preemptively address some of those, and also, just recall some of the questions that have been asked, and I can, answer them in, I guess, a belated fashion here. So here goes. So this video goes back to October of 2022, which was, in the heart of the pandemic. This cyst was called back pop easy as 1, 2, 3. So it sounds like we're gearing up for a punch excision. I don't remember exactly what this was, but we will watch it together. So the first step is, you can see I'm numbing up the patient. A lot of folks will actually say in the comments that, oh, you're numbing so fast that it looks like it hurts. Well, we really actually edit a lot of that out. So the first shot that I administer is the only shot that the patient really feels. And then I administer anesthesia into the already numb areas. So although it may look like I'm, being aggressive, it's actually the patient's not really feeling it. And here we go. I got my punch here. So I use a punch. This is a question that we get a lot also. I use a punch tool if a cyst is less than a centimeter in diameter. So the biggest punch tool I use is actually an 8mm punch tool. And this might have been actually an 8mm cyst. And you can see I punch the cyst, I go down into the subcutaneous tissue, which is, below where the cyst lives, and I just pop it out. So that was, probably an 8mm cyst, punched it out, and you can see there's a sort of a perfect circular defect there. And then what I typically do is I just make sure I got all of that cyst out. So I'll use my pickups and just kind of move the skin around to make sure that this entire cyst wall has been removed. And if it hasn't, I'll go in and I dissect that out. In this case, it doesn't look like I need to do that. And then I will apply my stitches. So a lot of folks will ask, about the suture technique that I use. So typically what I'll use is something called a vertical mattress stitch, where I basically close up the dead space using the suture. So I'll do like a suture that's kind of very far away from the wound margin, and I'll do like a little stitch that's very close to the wound margin. And what that does is it actually gets rid of some of the dead space that's left behind by the cyst that was living there. And you'll notice I'll frequently tell my patients, saying you might notice like a watery, bloody discharge coming from this area. That's serum/blood, which collects in the potential space that's left when you remove something from the skin. But I like this type of stitch, and I don't like to use deep stitches or dermal stitches for cyst removals, because I want anything that's collecting to be able to escape. Whereas if I'm removing a skin cancer or like an atypical mole or a melanoma or something like that, I will use 2 layers of stitches. I'll use deep stitches and superficial stitches, because I'm not really worried about anything collecting in that potential space left behind, because there isn't a potential space. So here we go, just applying those stitches. This is probably about 3 or 4 stitches given the size of the defect. I tend to get a little bit OCD when I'm placing these stitches, but I think my patients do appreciate that. So here we are. Looks like we're going to put another mattress stitch in here, and you can see those stitches going in now are very close to the wound margin, the edges there, and we'll tie that up, and that will close some dead space. As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these 2 amazing Dr. Mudgil brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do. see it's coming together very, very nicely. And this will leave like a very small linear scar for my patient when all is said and done. I also frequently say, the stitches are placed for the 6-month result, not the 6-second result. So sometimes it may look like it's, there's some space between the stitches, or, it may not look perfect, but everything is done with intent. And again, the way we close a wound is so that it looks great down the road and for the rest of my patient's life, rather than looking incredible right that second. Because sometimes if it looks too perfect, there's too much tension on the wound margins, and that wound or that defect will expand over time, which I'm trying to avoid. So again, all these stitches are placed for the long-term outcome. And looks like we're getting another mattress stitch in there. So we got 3 mattress stitches for a pretty small defect, to be honest with you. But again, I prefer to err on the side of being a little bit obsessive and compulsive with suture placement. And you can see that's coming together very, very nicely. And the other thing we get a lot is, like, why am I wearing my watch during these procedures? Well, the reason is because these aren't sterile procedures. These are clean procedures. So I'm not even wearing sterile gloves. That stitch is giving me a hard time there. So I think I'm just going to cut that whole thing out and put a new one in. There we go. Let's see what's happening now. If you're feeling the music we used in this video, you can go to the description below and click on the link to the Docs YouTube playlist. So we got one more stitch in the middle there, just to kind of close up or approximate the wound edges a bit. And I think that would probably be it. And this is just a conventional stitch, not a mattress suture. And I'm probably telling my patient now that, there might be a watery blood discharge. Put some Vaseline over the stitches, which I like. It keeps the wound moist and kind of helps some of that crust that develops over the wound. It helps it to, easily slough off. I also tell my patients to take the dressing off when they take a shower. Just let the soap and water run over the area, just so like any schmutz, folks love when I use the word schmutz, any schmutz kind of wipes itself off. And then when a patient gets out of the shower, apply a fresh coat of Vaseline or Aquaphor and a Band-Aid. What I'm doing here is I'm actually getting some of the stitches get like stuck under the other stitches. So I'm just making sure that they're all free and clear. Taking a final look here, make sure everything looks good, that the wound is approximated well, which it looks like it is. And that's it. That's a wrap. And this patient had a great outcome. We took the stitches out. Stitches stayed for 2 weeks. I tell my patients to take it easy while the stitches are in. So what you don't want is those stitches to pop, because it will heal if the stitches pop, but it just doesn't look great. And obviously we're trying to optimize functional and cosmetic outcome for my patients. So if you have any questions, please drop them in the comments below. As you know, I do read every comment and respond to almost all of them. I hope you enjoyed this video. Let's get it.